Although some residents across Chicago are emerging from the COVID-19 lockdown, for others, the fear of the virus remains. This is a drive-through testing site at Norwegian American Hospital in Humboldt Park. The community is largely Latino and African American, rich in cultural diversity, but with high unemployment and low incomes, and one that has been ravaged by COVID-19.
The stress in the ICU is really enormous.
Jose Sanchez is the CEO and president of this safety net hospital, a hospital that provides health care regardless of insurance status.
The issue that we have is that oftentimes some of those patients required higher level care that we cannot provide them here at our hospital. We struggle every single day. We do not have hardly any beds because we cannot move patients out of the hospital.
Latino communities in the US have been hit hard by the pandemic. According to the New York Health Department, Hispanics are dying at rates more than 50% higher than white residents. A high rate of people with blood pressure and diabetes is one factor. A large percentage of frontline and essential workers is another. And then there are the economic implications.
The fact that our healthcare is so tied to our employment is an indication of there are the haves and the have-nots. You also don't have the luxury to take time off of work. You know, if you are reliant on that job and you don't have any other source of income, it really becomes one of these kind of pick your poison situations.
To underline the extent of the crisis in this community, the staff here tell us that almost 40% of its COVID-19 tests come back positive. And that's a rate that stayed roughly constant since testing began.
For medical staff, the pandemic has taken a toll.
I think that it's put a strain on all of us physically and mentally.
Workers fear that a second spike of the virus will lead to more devastation within the community.
We're not in the clear, and I think that's the message that we want to get out, that this disease is not gone. We still don't have a cure. We still don't have a vaccine. So as quickly as the numbers can go down, they can go back up.
Chicago's high coronavirus infection rate among Latinos is mirrored in cities across the country. Although some communities are opening their economies with optimism, others fear what comes next. Dan Williams, CGTN, Chicago.